Welcome to another Apollo Papyrus episode. I am Aaron Apollo Camp. For this episode, my interview guest has considerable experience as a neurosurgeon and is the author of the fictional novel Death's Pale Flag, as well as the nonfiction books The Thriving Physician, Thriving in Healthcare, and Building Resilience in Neurosurgical Residents. His name is Dr. Gary Simons, and here's my interview with Dr. Simons. Dr. Gary Simons, welcome to Apollo Papyrus.
Well, thank you so much for having me.
Feel free to introduce yourself to our listeners.
I by training am a neurosurgeon, but I hung up the knife a few years ago for a number of reasons, some of which out of my control. But I continue to teach neuroscience to undergraduates and medical students, and have been doing a lot of writing since.
Without spoiling too much of your novel, Death's Pale Flag, what is your novel about?
Well, of all things, it's about a brain surgeon. And the brain surgeon, we go through kind of the life of a brain surgeon with the typical encounters day to day. But this brain surgeon is a little bit on the workaholic side and probably a little burned out, and begins to see things that aren't there. He originally thinks that they're hallucinations, but then begins to convince himself that they are actually ghosts. And these apparitions, they appear to him with greater and greater frequency, and this begins to unravel his home life and his work life.
Why did you choose to write a fictional novel to tell a story about workplace burnout in the medical field?
Well, it was more than just burnout that I wanted to address. I mean, I guess for a long time I always wanted to be able to give people a peek into that world of neurosurgery, of modern day neurosurgery, because it's a pretty rarefied air there, a pretty kind of strange universe that probably most people don't have much idea of what's going on. And then I started writing nonfiction account of it and thought it was too boring. And I thought it would be much more immersive for the reader to be able to kind of get themselves inserted into a story and actually hopefully feel what it's like to be there at the head of a table when somebody's brain is bleeding, and it's running onto the floor, if you will.
In real life, how serious of a problem is burnout and mental health issues among physicians and other healthcare practitioners?
It's a real problem, and I don't think it's limited just to the healthcare world, but certainly it's plentiful in the healthcare world. There's estimations that healthcare workers, 50 to 70% are experiencing one level of burnout or another here and now. And so it's considered a major issue, and certainly runs a risk of impacting patient care.
In addition to Death's Pale Flag, you've written 3 nonfiction books: The Thriving Physician, Thriving in Healthcare, and Building Resilience in Neurosurgical Residents. I understand at least a couple of those were co-written. Without spoiling too much of each of your nonfiction books, what are they about? And for the ones that you co-wrote, who are the co-authors?
Yeah, we co-wrote all 3. For the last 15 years or so, I became very involved in looking at studying and trying to help people with burnout. And we, very much focused on the healthcare world because that was my world. But I was lucky enough to partner in these efforts with a world expert on burnout, a clinical psychologist, Wayne Sotil, who is marvelous at this stuff. And he and I worked for several years together, particularly on my team. I headed a neurosurgery team of of neurosurgeons, neurosurgical residents, PAs, nurses, a pretty large team at a big hospital. Um, and and then we started writing about our experiences and broadening it out to the healthcare public altogether. And frankly, I would say very much a lot of what's in the books is applicable to everybody, to all professions, because I think in this kind of modern day world that we're all in, where we're all multitasked and going a mile a minute, I think there's burnout in everybody's lives.
BQB Publishing is the publisher of Death's Pale Flag. What type of publisher is BQB Publishing, and what was it like to work with them?
They've been great to work with. They're an independent publisher, and they go with a hybrid model, meaning that there are parts of the process which I will pay for. For example, the developmental editing. When the book was turned to a uh, uh, Audible book as well, and so you pitch in for some of the expenses there. But they've been great to work with, and I think did a very good job in editing and setting up the book. And I think it has a great cover, to be frank, and helping getting it out there and getting it in the multiple social media and getting it, to the various sellers. So it's been a great relationship.
Which company or companies published your nonfiction books, and what type of publishers are they?
They are a medical consulting organization that has a publishing wing, but overall it's called Huron. And so they are kind of a more traditional publishing system, but but not, one of the big four, or is it five? I don't know.
I'm going to ask a question that I did not have written down. Have you ever had like a supernatural or ghost sighting or ghost interaction experience while doing neurosurgery?
Uh, I was gonna, as you were asking the question, I was gonna say, I wish I did. I wish I did have a ghost experience. I certainly don't wish I had it at any time during surgery. But yeah, no, I personally never have. I come out of a family. My mother's side is British, Scottish. My mom, my grandmother, who lived with us when I was growing up, had many experiences. So I was surrounded by a lot of discussion of the paranormal, and as a kid, read every ghost book I could get my hands on. So that probably had a significant influence. I'd love to come across a ghost. Unfortunately, I have not.
Tell us one or two of your spooky Scottish ghost stories from your childhood.
Well, I think one of the ones that's interesting is my mother. When she was young, the family moved from Scotland down to England, and her father ran a pub and an inn. So they lived in the inn upstairs, and when my mom had a room in the inn, and she started complaining that in the middle of the night she could feel the bed move, the end of the bed get lifted up, that drawers would open and close, that a closet door would open and close. And her parents, originally said, yeah, sure, it's probably just buses going by, or there was a train track nearby, and maybe it's just the train. And but it kept bothering her, and she kept complaining about it. And they finally contacted the previous owner of the inn, and he said, "Oh yeah, no, that's room 23. Everybody knows that's haunted." And so kind of in typical British fashion, they say, "Well, I guess that explains it," and they never moved her out of the room.
In all honesty, which is more fun, writing nonfiction or telling ghost stories?
Oh my goodness. Telling the ghost stories and writing fiction for sure. I think, my entire professional life was writing nonfiction in one way or the other. It's not necessarily in books, but you have to write every patient's story down, one after another. We do a lot of scientific writing and research writing and all that stuff. And I enjoyed writing the burnout books, but after a while, it begins sometimes to almost feel like a book report back in high school, and I got to get it done, and and it's very restricted, in what you can and should write. Whereas with the fiction, all of a sudden it just blows the world wide open. Anything can happen, and anything does happen. I have to tell you, when Death's Pale Flag, when I first finished it, it was 250,000 words, and I realized it can't be, it can't be even half that long. So I whittled it down to around 100,000 because I figured nobody would read it at that size. So all sorts of crazy things were happening. So it really lets your imagination run wild. So definitely much more enjoyable.
What was the hardest part of cutting down the word count to a an amount that you thought that most readers would be able to read? Uh, what was the hardest part of getting your word count down to what you thought was a more reasonable size?
Yeah, it's a great question. And I was so new at doing this on the fiction side that I sought help because it was hard for me to figure out where and how I could do this. It felt like everything had something to do with the story. And I had a couple different developmental editors take a look and give me suggestions. And then all of a sudden, it kind of opens your eyes to, boy, if it's not really contributing to the absolute flow of the story, then you probably don't need it. And that helped me a lot, where it got much more lean and mean, by recognizing that. And I know some authors talk about, it's like killing your children or something when you get rid of your own writing. But I found it, I don't know, I found it kind of interesting and fun, figuring out eventually what could go and what couldn't go. So there were a lot of side characters and side stories that I enjoyed, but it wasn't really contributing to the story.
One final question. What are your thoughts and opinions about the current state of the American healthcare industry?
Oh my goodness, do you have a few hours? It's problematic. It is lumbering under its own financial weight, if you will. It takes up a huge amount of our gross national product. It's very expensive, in other words. And part of the reason for that is it can be, we're a rich nation. We have oodles of money, but it can't keep eating up the finances of the country forever, and it just keeps skyrocketing in costs. So we're going to have to figure out how to contain the beast, and that becomes hard because with that much money flying around, everybody wants a piece of the pie, and they're going to fight hard for that piece of the pie. And so all the vested interests, they have big lobbying down in DC. They pour a lot into lobbying in the DC. So it's going to take a lot to change it. We offer amazing care when you are super sick. If you're super sick and you hit any of the major hospitals in the country, you're going to get amazing care. Where we tend to fall apart is in the day-to-day care, in keeping people healthy, in keeping diseases held at bay rather than once the person has them.
Dr. Simons, thank you for appearing on Apollo Papyrus. You are a wonderful guest, and the construction that's going on at your house did not affect this interview too much.
Oh, good. That's great to hear because I felt terrible about it. But it just ran over from where we thought it would. I guess like a lot of things in life, right?
I always enjoy interviewing authors with experience in both fiction and nonfiction writing. This is Aaron Apollo Camp reminding y'all to write and read your passion. Bye for now. Remember to subscribe to the Apollo Papyrus YouTube channel at www.youtube.com/@Apollo Papyrus and the Apollo Papyrus Substack newsletter at apollopapyrus.substack.com. Y'all can visit the Apollo Papyrus website at campaaronapollo.wixsite.com/Apollo Papyrus and follow Apollo Papyrus on Threads, Instagram, Facebook, and Tumblr at Apollo Papyrus. Copyright 2024, Aaron Apollo Camp, all rights reserved. This podcast episode is intended for the private listening of our audience. Any reuse or retransmission of this episode without the express written consent of the podcast host is prohibited, except under fair use guidelines. Royalty-free music and sound effects obtained from https://www.zapsplat.com.